Hi everyone, I'm Joanne. I'm from the Queensland University of Technology, and my research is on exposing prostate cancer cells as dangerous cult leaders. You probably know that the immune cells in your body help to protect you, right? But did you know they can also be manipulated to help cancer? Take, for example, prostate cancer, the second most diagnosed cancer in men worldwide. If diagnosed early, doctors have good options available to treat the cancer, for example, through radiation therapy. Unfortunately, in some cases, the cancer develops strategies to become resistant to these treatments, grow, and even spread to other parts of the body. And it appears that other normal cells in the body, including immune cells called macrophages, they're being manipulated by the cancer cells to help achieve this. Almost like some of these historical cult leaders we watch documentaries about. So what is it that makes the prostate cancer cells become these charismatic leaders that can dazzle the cells around them, particularly those that are meant to protect us, the macrophages? How do the prostate cancer cells convince the macrophages to help them out rather than fight them? To expose the cancer's brainwashing strategies, we are trying to mimic that situation in the lab. Okay, so we put prostate cancer cells, normal tissue cells, and macrophages all together into the same dish with jelly, which resembles body tissue. And then we can treat them with radiation. We can then closely observe how all cells interact with each other over time using microscopes. We can also measure the levels of proteins inside the cells and the proteins that the cells release into the environment, which is sort of their way of communicating with one another. And we can even add different drugs to the mix and see how it affects the dynamics. Once we have collected all the information, we will have a much better understanding of how the prostate cancer cells attract the macrophages, how the prostate cancer cells convince the macrophages to help them escape treatment, and most importantly, which drugs could actually work to stop this. In the future, we may even be able to use cancer cells from individual patients and test how those specifically would react to different drugs and then choose the optimal drug for each patient. So knowing these details will help to develop better treatment options for improved outcomes so that one day the cells in your body can recognize the cancer cells for what they are: charismatic but dangerous cult leaders.